Hi, I'm Dr. Ron Cooper, and welcome to our Thyroid Recovery website. If you're here, you're probably here because you've been newly diagnosed with a thyroid problem, and maybe you're just looking for some answers. But our website will tell you a lot about thyroid problems, but it'll also tell you about what makes us different from any other doctor you've been to, and a little bit about how we can help you when everybody else has probably failed. If you're here and you have a thyroid problem, especially a hypothyroid problem, I feel for you. The fatigue, just the sluggish, tired feeling, the mentally slow. You can't lose weight. You try to lose weight and it just can't do it. You get up every morning out of bed and you're tired. Your hair's falling out. You're constipated. It's really frustrating. But about all that's offered for you in our world is hormone replacement therapy. And, in our model, people get hormone replacement therapy and they still feel bad. And if you're here at this website, that's probably where you're at. You're on hormone replacement and still feel bad. But I'm here to tell you that that's not always the answer for you. In our office, we look at patients a little bit differently. We look at you from a functional perspective. When I say a functional perspective, is the pituitary telling the thyroid gland to produce thyroid hormone? Is the thyroid hormone producing the hormone that it's supposed to produce? Is that hormone traveling through the body correctly, like it's supposed to? And then, is it getting into the cells and driving your metabolism like it was intended to work? So we look at you from different perspectives. In a medical model, usually my experience has been a patient will come in and they'll have a TSH or a T4, and that's about all that's ran on them. But there's like 12 different markers we can run, not just a TSH and a T4, but a total T4, a total T3, a T3 uptake. We can look at your antibodies, TPO and TBG. There's a whole host of different things that probably we can test that probably don't mean a whole lot to you. We can also test some other things that aren't necessarily thyroid tests, but work and correlate with the thyroid to give us a better overall picture of what's going on in your system. One of the things that we see a lot of is Hashimoto's hypothyroidism. Hashimoto's is an autoimmune thyroid, where the body's actually attacking the thyroid itself. And if you have Hashimoto's, you really, how do I say this so it makes sense? You really don't have a thyroid problem per se, not principally. What you really have is an immune system problem. And you have to address the immune system first, figure out what's causing the body to attack the thyroid, balance that, and then look at the thyroid second. So I can get into this a whole lot more in depth, and it may not make a lot of sense at this point, but I have